Hi there, I am Dr. Sanyukta. The topic of today's video is one of my favorites. Let us discuss in today's video the most important, the most interesting, but the least understood topic, centric relation. So let's get started. I am Dr. Sanyukta. I practice extensively in temporomandibular disorders since last many years. What I have found is that one of the most important concepts that you should have thoroughly understood is the centric relation. Before you can understand centric relation, you have to understand a normal temporomandibular joint. So for those of you guys who do not have an idea of how a normal temporomandibular joint looks or how it functions, please go back, take a look at my video on the normal temporomandibular joint and come back to this video. Centric relation actually is a bone-to-bone relation. It is the relation of mandibular condyle to the articular disc and the relationship of this condyle disc assembly to the articular fossa. It has nothing to do with teeth or your jaws. So this is the first important concept to understand it easily. The jaws and the teeth come in picture later. Whenever the condyles are positioned against the intermediate zone of the articular disc such that the disc is positioned in a 12 o'clock position over the condylar surface and this condyle disc assembly is positioned most anterosuperiorly in the articular fossa against the posterior-superior surface of the articular eminence, this bone to disc to bone relationship is actually called as the centric relation. Now, why is centric relation so important? Centric relation is so important because it is the only position where the masticatory musculatures are in harmony with each other. Now, what does that mean? That means that when the elevators are working, the depressors are quiet. When the depressors are working, the elevators are quiet. You would say this is how it is always. No, that is possible only when our occlusion is in harmony with the centric relation. Another reason why centric relation is so important is that it is a repeatable position. It is a recordable position. So you can predictably record the centric relation and transfer the same to your articulators and plan an occlusion which is in harmony with this centric relation. So when you have planned an occlusion which is in harmony with the centric relation, when the patient opens the mouth, only the depressor, the inferior lateral pterygoid muscle will be in function and all the elevators will be at rest. In this occlusion, when the patient closes his mouth during eating, during swallowing or during parafunction, all the teeth will meet such that the condylar position will be in its centric relation. So only the elevators will be acting and the inferior lateral pterygoid will be completely quiet. There will be no fight between the two antagonistic muscles and you will not have any muscle disorders. Since the joint will also be comfortable, you will not have the joint disorders either. So always plan your full mouth rehabilitation cases into centric relation. Also, whenever you do any orthodontic treatment, try to create an occlusion which is in harmony with the centric relation. So now that you have understood what is centric relation and that you have understood why is it so important and where all you will need it, the natural question that will come to your mind is, what if we rehabilitate a patient into an occlusion which is not in harmony with the centric relation? What if we do a full mouth rehabilitation in maximum intercuspation? Or simply for general dentist, what if we place a restoration that is interfering in centric closure? We place a high crown or a high composite restorations. What would happen? To know the answers, stay connected to my video series. This is me, Dr. Sanyukta, signing out.